Hey YouTube, it's Marida and welcome to another edition of the Nurse Lounge. And in this edition, we're actually going to talk about scopes of practice. And people are like, well, what do you mean? Scopes of practice. You know, what is it that governs what you can and can't do within your nurse practice regarding your licensure as a LPN, RN, or so forth. So we're going to kind of talk about scope of practice a little bit. If you want to see what I'm talking about, stay tuned. Back. My name is Dr. Marida P. I'm a registered nurse. I've been a nurse for 17 or almost 17 years. OBGYN, well baby nursery, is my specialty, and I am a nurse educator at a HBCU, and I'm doctorally prepared. So today we're going to talk specifically about scope of practice. What does that actually mean? What does scope of practice mean? So I'm going to look it up actually. I have my computer here. Okay. So we're going to give you a generic definition of what scope of practice means. I'm actually looking at my computer right here. So if you want to know what I'm looking down for, that is what I'm looking down at. And so a scope of practice in general, so I'm not speaking specifically to nursing, but in general, a scope of practice basically means it describes the procedures, actions, and processes that a healthcare practitioner, which would include nurses, is permitted to undertake in keeping with the terms of their professional license. The scope of practice is limited to that which the law allows for specific education and experience and specific demonstrated competency. Every jurisdiction has its own laws and licensing bodies and regulations that describes these regulations. So that's in general what a scope of practice means. So you have to be able to practice within a scope of practice that is within your scope. So what I'm finding is I am teaching a lot of LPN. I'm actually teaching in a bridge program. And the bridge program is an LPN to RN bridge program. And when I talk to a lot of the LPNs about their current practice, they actually are practicing out of their scope. A lot of their jobs are having them practice out of their scope of an LPN and actually practicing within a scope of a registered nurse, not an LPN. And the problem with that is if you don't know what your scope of practice is for your particular licensure and position, you, my friend, can lose your license if you are found to be doing something that's not within your scope. If you cause some kind of harm to somebody, you could lose your license if you're not following your scope of practice. So here's an example of something that an LPN can do, or that an RN can do, that an LPN cannot do. So in most places. Now, before I go here, some things are determined by the Board of Nursing's policies or scope of practice clause. Because in Tennessee, we may be able to do something that you in Louisiana can't do, as an example, or vice versa. Because the Board of Nursing kind of helps determine what the scope of practice is for your state and for what you do, okay? One of the governing bodies that does that. So with that being said, a LPN cannot do initial assessments or admissions. They cannot typically. Not in a hospital setting anyway. Registered nurses have to do the admission, but then the LPN can follow up behind the RN. At least that's how it is here in Tennessee. If it's something different where you live, comment that below. But LPNs in a hospital setting, if you're still practicing in a hospital setting, cannot typically do an initial admission assessment. That's the head-to-toe assessment, the screenings and things like that. That has to be done typically by an RN. But I have seen times where LPNs have done admission assessments. They're asking the questions. They're asking, have you been out of the country? They're asking, do you have a history of this? Have you a history of that? Now, in LTCs, that may be true there. Whether you can actually do it or not, I don't know because I don't work in LTC. But I do know they do assessments. However, I'm speaking specifically in the hospital settings that typically they cannot do in Tennessee specifically. So again, I'm not speaking in general, I'm speaking what we have here. Cannot do an admission assessment. They can do a follow-up. Most places, LPNs cannot hang blood, as far as I know. RNs can do that. They can do the vital signs after the first 15 minutes, but they can't do the initial blood administration type thing. They can take care of the patient, but they cannot manage the blood component of it. Is what I'm trying to say. So if the patient, called out and said she needs some pain medication, the LPN could go in and give the pain medication. That's oral medication. Unless you've been certified as an LPN to do IV meds, unless you've been certified, you cannot do IV push medications because you're not certified to do so. You have to have certification. So just because you are LPN don't mean you can do something. You have to be certified in that area to do something. Otherwise, you are not practicing within your scope. So let's move on to RN specifically. So people think, well, as a registered nurse, I can do it all. No, you can't. Here's a prime example of my scope of practice as an OB nurse. So on my floor, let's say I have a patient who is seizing, okay? She has eclampsia, as an example. She is seizing. Well, first of all, she wouldn't be on postpartum, no way. She'd be actually going to the ICU, to the unit. But before we get her over to the unit, she goes back to labor and delivery. Labor and delivery will, depending on where she sees that, if she sees in labor and delivery, she goes to the unit. If she, depending on what's going on with her, well, from postpartum, we probably send her to the unit as well. But let's say, for instance, she needs some hydralazine. So we, that's like drip medications, or she needed some type of, medication via drip, mag sulfate, things like that. That's something we don't do on our unit. I'm not one to do those medications. So hydralazine, or a blood pressure medication that requires a drip, is something that requires a certain kind of nurse to do. So even though we are registered nurses, we all cannot do the same things. So you have to be someone who's been taught how to do those type of drips. And for those kind of medications, you have to have a patient with a monitor on. On our floor, we don't monitor our patients. So therefore, guess what? That's not within our scope. We have to send them to a unit in which they can be monitored, in which they can get the medications given to them in an appropriate manner. And then that nurse is practicing within their scope. If I try to do that, even though we're both RNs, if I try to do that, I am not practicing within my scope of practice. So I want to make sure you understand that even as a registered nurse, we are still not able to just do whatever we want to do. You have to practice within your scope, even as a registered nurse. So there's things that a labor and delivery nurse can do that a postpartum nurse can't do. Because again, we have two different scopes, even though we're registered nurses. Labor and delivery nurses are someone who, if push came to shove, they could catch a baby, meaning that if the doctor didn't show up or didn't get there on time, they could deliver a baby. Is it ideal? No, but it's within their scope and it happens all the time. As a postpartum nurse, it could happen. It should be very rare if it ever happened, but that's not my scope because I've not been trained in electronofetal monitoring. I've not been trained on how to properly assess a laboring mom because I'm a postpartum nurse. I'm not an L&D nurse. I hope that makes sense. So there's a lot of things we do. They have been trained to go up into the vaginal vault, to that cavity, and feel around in there and make sure there's no clots and stuff in there and pull that out if they could. They can do that with a sterile glove. I've not been trained to do so because I'm a postpartum nurse, so that's not within my scope. Again, pulling the epidural catheter out somebody's back. Is it something I'm capable of doing? Yes, but technically not within my scope because the L&D nurse does that, or anesthesia does that, typically. But is it something that I know how to do? Yes. Have I done it before? Yes. Have I ever practiced outside my scope and didn't know it? Yes. That's the reason why I'm telling you now, you need to learn your scope of practice for the area in which you work in. And know that you cannot do everything that you want to do just because of the fact that you have a certain license behind your name, registered nurse behind your name. Now, with that being said, let's talk about scope of practice, so to speak, when you are going from one level of education to another. So we're going to move out of the hospital setting. We're going to move out of the hospital setting. And we're going to go say that you are now wanting to be a student again. So I have people who are LPNs who are going to school to be RNs, or maybe they're a paramedic or EMT and they're going to school to be a registered nurse. Well, there's certain things they're able to do at their job as a paramedic, EMT, whatever. And there's certain things you can do as an LPN, but you can't do those in nursing school because you're not practicing within your scope. You're a student again. So keep in mind that even if you know your role as what you do in your everyday life, when you come to school, you become a student. So you can't be doing stuff all willy-nilly because, oh, I do this all the time in practice. Well, today you're not in practice. You're a student today. So you have to kind of stay in your lane as a student and make sure you practice as a student. That's still kind of like within the scope of practice, so to speak. Because let's say as a 2-year RN, maybe you're doing an RN to BSN program, so you're already a registered nurse, which means you can already hang blood and stuff like that. But you're going back to school to get your BSN, as an example. Well, if you're going to school to get your BSN, as a student, you cannot hang blood. But if you're already an RN, you already know how to hang blood. Because they do go to clinicals too, or some of them do go to clinicals too for RN to BSN programs. They go to some clinicals as well. Some schools do, not all. Some schools are exclusively online, but I have seen some programs that for the RN to BSN, they had clinicals as well. So there's certain things that you can do. I'm just giving you the blood as an example. Maybe you know how to hang blood because you do it all the time in your program or in your current job, but when you go back to school to be a 4-year RN, the BSN, while you were in school, you cannot function that way. You cannot do something that as a student that you would do as a nurse. So you have to take your nurse hat off and put on your student hat and wear that for the day and not function at that level because that's not within your scope as a student. So hopefully that makes sense to you all. This is not a long video at all. I just want to kind of talk about scope of practice because I see so many people who are not practicing within their scope of practice. And I want to make sure you understand that RN does not mean that you can do whatever you want to do because you're a registered nurse. Even within our own scope, we have our own scopes of practice. So I can't go to ICU and do what they do in ICU because that's not within my scope. I have not been taught or educated that. I don't have the credentials to do so. A nurse is not a nurse is not a nurse. You will hear older nurses say that all the time, that a nurse is a nurse is a nurse. No, we're not. We are specialized. And once we become specialized, we are specialized in our specific area of nursing. And though some of the things do transfer into other areas of nursing, so I can do a head-to-toe assessment on anybody. But that don't mean I don't know. That don't mean I know what's wrong with them. I can use my foundational assessment skills to say, okay, you know what? Their respirations are not correct. Their lung sounds are crappy, this, that, and the other. I may know they have pneumonia, but I may not know the medications as well for that. I know they need an antibiotic or some sort, but I may not know because I'm not familiar with it because I don't do this in real life. So we want to be making sure that when we are practicing, when we're doing these things, we're talking about what is the patient going to be like in real life, how to take care of this patient in real life, how is it within my scope of practice? Can I really do this as a nurse? And you need to learn that. So you need to learn that how. Let's now move to how do I find out what my scope of practice is? For one, the State Board of Nursing tells you what you can and cannot do. Go to the website, number one. Number two, your hospital or clinic should be able to tell you what you can and cannot do. However, these are the very people who will have you doing what you cannot do. So you have to make sure that what they say they want you to do and what you are legally allowed to do is the same. They will tell you things or have you set up to do things that you should not be doing as a nurse, period. And it's up to you to figure out what's right and wrong. And if you don't do so, then guess what? You could be practicing out of your scope. And that's not a good thing. And when something happens or if something happens and it comes back on you, they will not back you up. So hopefully this has been insightful for you. Hopefully you've learned a little bit from this video. I really appreciate you all watching this video. Please like, comment, subscribe, and share the video as well. Until the next time, if you want to follow me on IG, it'll be somewhere on the page. But until the next time, you all take care. Bye-bye.